Hello and welcome to today's training on sensory processing disorder. My name is Lauren Lavery and I'm one of the occupational therapists over at Tualatin Early Childhood Center. Okay, I'm going to go ahead and share my screen with you. And we will get started. Okay. All right, so this training was initially written for speech therapists, but I thought a lot of people could benefit from this, including instructional assistants, other staff members, teachers, and parents. So we will get started. Okay, so today we're going to discuss the 8 basic senses, including the big 3, which we'll talk about. We're going to learn about sensory processing disorder, risk factors, prevalence, physiology, all the subtypes of sensory processing disorder, and we'll also talk a lot about autism spectrum disorder and some of the ways in which kids with ASD can fall into those SPD categories, because a lot of kids with autism spectrum disorder have symptoms of sensory processing disorder. We'll also talk about clinical versus educational models for treatment, especially when it comes to OT services and also just the way we help kids with autism spectrum disorder in the schools. And then we'll do a special focus on the sensory modulation disorder subtype of SPD, because that really is one of the subtypes that can impact emotional regulation. And so it's really important to understand that one. So we're going to talk about how to spot children with sensory modulation challenges, strategies to support these kids at home and at school, and then just when and how to use some of the sensory strategies so that we can help kids stay regulated. Okay, so the 8 senses. We have our sense of vision, sense of smell, our gustatory sense, which is taste. The little yellow circle corresponds to vestibular input. So we're going to talk in depth about the vestibular system, but that's basically your sense of motion, linear movement, rotational movement, where your head is in space. At the bottom, you have auditories, your sense of hearing. The hand represents sense of touch. And then the pink circle is the sense of proprioception. So that is your muscles and joints, so that we know where our body is in space and how much force to use in our muscles. And then recently, an 8th sense was added, interoception, which is represented by the little stomach. So that's basically your internal organs, things like if somebody knows that they're hungry or thirsty, that would be an example of interoception. Okay. So just real quick, sensory processing, basically it happens in the brain. It does not happen in the nerves, for example, of your hands. So everything has to be sent to the brain to be processed. When it's in the brain, and it goes to all, depending on what the sensation is, it goes to different parts of the brain. And that is where the sensation is detected. So it tells your brain, what is the sensation? Where is it coming from? It's perceived. So for example, if you're detecting tactile sensation, it's what kind of tactile sensation? Is it bumpy? Is it scratchy? Is it smooth? And then it's modulated. So that's basically when the brain is saying, how bumpy, how smooth, how scratchy, is this painful? Like how painful, what is the level? And then the outcome of sensory processing is what we call an adaptive response. So that's really anything that comes out of the brain's ability to process and make sense of this information all together. So that's movement, coordinated movement, problem solving, language, withdrawal from danger, emotional regulation, social engagement. Everything's impacted by sensory processing. So we'll talk about the big 3, the proprioceptive system, the vestibular system, and the tactile system. So these 3 really have to work together really well in order so that we can plan our movements, maintain our posture, maintain our equilibrium. If we didn't have these senses working together, we would not be able to be upright. And it helps us understand where we are in the space around us. So it really, these 3 systems are really important for us to understand all the signals from within our body and also from without our body. So the outside world, our connection to the outside world as well. Okay, so the tactile sensation. This picture on the right is a representation of the proportion of our brains in their tactile part of our brain, which is the primary somatic sensory cortex in the parietal lobe, so kind of on the side on the top. And you can see the overrepresentation of the hands, the tongue, and the mouth, and the lips. So those are spots that are particularly sensitive when it comes to tactile input. So it does kind of make sense then when you have kids with sensory processing disorder, for example, if they are tactile defensive, that's why they maybe wouldn't want to touch something with their hands that's sticky or gritty. And that might be why they may not want to, you know, picky eating can be a problem because you have that mouth tongue being so highly represented, and those sensations are really coming in strong for those kids. So imagine if you have an aversion to a certain type of texture, touching it on your hands would be a big deal, and touching it to your mouth and your lips would be a big deal. Okay, and then this is a homunculus. So this is as if you were to slice that somatic area of your brain down the side and see a cross section of it. Just the size of each sensory organ is showing how much of that brain is really dedicated to the processing of sensory input from those particular organs. So again, you have your hands, and particularly the thumb, very big. Eyes, nose, mouth, lips, tongue, all big players in the tactile system. Some examples of tactile activities that are preschool age, toddler and preschool age would be, you know, sensory bins, things with gritty textures. You see on the left, rocks and sand. In the middle, this looks like, you know, just there's a little play activity where you get your little pets muddy and dirty, and then on the right side you have the clean water and a little toothbrush, and you can scrape them clean. A lot of sensory input in that activity. And then for the kids who might be a little bit not willing or not excited about touching some of those textures directly, you can also put squishy gooey things into Ziploc bags and have kids manipulate it in a way that's safe to them. More examples of, these are some tactile activities that give a little extra feedback. So if kids aren't quite registering that tactile input well, some things you can do. This little girl's stringing beads, and one of the strategies that would help with her tactile system, help her kind of register that better, would be to tie little knots down the string so that as she's stringing the beads, she can kind of feel the bump, 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 bump of those knots. Coloring on sandpaper is really good, especially for kids who aren't quite registering that tactile input very well. Sandpaper really creates a lot more drag on the crayon. It helps the brain understand, oh, I'm coloring and my hand's moving, as opposed to, for example, a whiteboard marker that's just very slippery and doesn't give as much sensory feedback. And then on the top left, there's you know, learning what the shapes are instead of just visually. Why not have some tactile input as well? So this is done in glue and glitter. Okay. Proprioception, this is how we know where our body is in space, how much force to use in our muscles. We have these little stretch receptors in our muscles and ligaments called Golgi tendon organs, where basically they're located in the muscle spindles, especially where the skeletal muscles insert into the tendons. And they're activated by stretch, and they help us understand, like, for example, if we were to pick up a cup of water, we know that we have to use a little bit more force than if the cup were empty and didn't have any water in it. Because from experience, we've picked up cups with water before. We know how much, our brains remember how much those weighed because of our proprioceptive system. Something to know is proprioceptive sensory input, and I will give some examples, tends to be universally regulating, especially for our pediatric population. Just that what we call heavy work, so those activities that give a lot of input to the muscles and the joints tend to be universally regulating. So if you're in doubt, try using some proprioceptive sensory input. So Some activities, so on the top left, you see kids who are laying on their tummies to draw. So that position of laying on your tummy gives a lot more sensory input than maybe just sitting or standing, because you have that weight of your body and gravity on your whole chest and belly. And also laying on your belly to color is good for other reasons, fine motor reasons, wrist extension. It helps you anchor your forearms so that you can move your wrist and fingers rather than your whole arm. It's just great. Put kids on their tummies when you can. Jumping on trampoline, that's a lot of proprioceptive input. Think about all the weight that's going on to those joints and hips and knees and ankles and feet. On the top right is a body sock. So kids get inside and they stretch and it's kind of tight in there and they can really push. Bottom left is a little play activity where kids are banging on things, and banging on things is extra input compared to just pushing a button. Bottom middle is you have a parent who's doing couch cushion and pillow squeezes with her kids. So just kind of that deep pressure can really help kids regulate and feel their bodies really extra nicely. And then of course, crawling is a really good proprioceptive activity as well. More examples, the kid on the top left is using his muscles to stir some cookie dough. So yeah, stirring and scooping kind of thicker food items is good heavy work. The kid in the top middle is pushing all his toys from his play area, from the shelf to his play area. Pushing and pulling are very good heavy work. The little boy on the bottom left is pulling his toys in a wagon. Top right, you have a kiddo who's doing some yoga. A lot of good extra joint input on these poses like downward dog and dolphin and things like that. And then on the bottom right, you have a kiddo who is putting together, or it looks like he's playing with the car with all that weight on his hands and arms. And so think about this kiddo. It's also a really nice way to kind of, if he has a hard time with attention, to focus his attention, because he's sort of right there in front of his activity, getting the heavy work. It's a nice way to position him. Okay, so the last of the big three is the vestibular system. So this basically, the receptors are in our inner ears, and you have these little things called the semicircular canals, and then you also have the otoliths. So the semicircular canals detect your rotational head movement, and the otoliths detect your linear head movement. So basically, it's the system that helps us know, are we moving? Are we still? Are we spinning? Are we upside down? Are we accelerating? Are we decelerating? So it really helps us with our balance, with our orientation in space. If you were to close your eyes and someone were to turn you upside down, you would know because of your vestibular system. The other important thing the vestibular system does is it helps us with our eye movements. So remember, it's the system that helps us keep our head in place with gravity, because we know where our head is in space. And so you have to have that vestibular system working pretty well in order to keep your eyes on something that's moving, or to fixate your eyes. So really you have to think about how important the system is as kids are learning to read, as kids are learning how to catch a ball. And then the vestibular system, and we're going to talk about this in a little bit, also has some functions that have to do a lot with like our visceral reactions. So for example, if our vestibular system notices that our body has adjusted, it might basically adjust our circulation and our breathing to kind of help support that position. So you can imagine kids who sit for a very long time and don't move out of that position might perhaps lose attention and alertness. But if you kind of maybe give them opportunities for movement, or have them sit on like a little cushion that wiggles, that vestibular system can get activated and kind of adjust circulation and breathing, which can really help with alertness. Okay, the vestibular system impacts our emotional state. So this is something to take note of. We have the limbic system, which is in this picture, basically the orange part. All these little parts of the brain are part of the limbic system. It's where a lot of your emotion is processed, and the vestibular system is extensively networked with the limbic system. And it also influences the higher centers in the central nervous system and the autonomic nervous system. So let's talk about the autonomic nervous system, because it's not something that everyone knows about, and also if you have learned about it, it's good to review. So basically, our nervous system can be split into two parts. We've got the brain and spinal cord, and then we have everything that kind of branches off from the brain and spinal cord. And then when you break down the peripheral nervous system, you have your voluntary muscles, so like your skeletal muscles, your reflex arcs, so you tap your knee and it moves. That's the somatic nervous system. And then you have the autonomic nervous system. So these are all the things we never really think about. So, our blood pressure, our heart rate, our pupils, things like that. And then the autonomic nervous system basically can either be sympathetic or parasympathetic. And so the sympathetic nervous system is our fight or flight system. So that's kind of what helped us as we were evolving to run away from danger or to fight danger. If a lion were to come with us, we would, all of our systems would get into gear for that fight or flight response. And then on the other hand, we have the parasympathetic nervous system where, that lion is far away. We can take the time to relax, sleep, enjoy our food, and digest. And more information here. So on the sympathetic versus parasympathetic. So some examples. So when we're stressed and when our sympathetic nervous system is active, some physiological things that happen, our pupils expand, our breathing gets fast and shallow, our heart pumps faster, and our gut is not interested in digesting our food, because remember, it has to respond to that lion that's chasing us. When our parasympathetic system is dominant, we feel calm, our pupils shrink, we take slow, deep breaths, our heart slows, and then our gut decides this is the time to digest our food. And it's important to know that kids with sensory processing disorder tend to have more dominance with their sympathetic nervous system than the parasympathetic nervous system. Okay, so the vestibular system balances autonomic activity by stimulating the vagal system. And the vagus nerve is one of the cranial nerves that comes out straight from the brain. But just good to know, it inhibits the sympathetic nervous system and drives physiology toward a much calmer state. So some examples of vestibular activities. So we have kids on a little seesaw and they're rocking. Swings can be very, very regulating. Something to take note of is that linear vestibular input, so back and forth, that tends to be a very calming and relaxing type of sensory input. And so you can probably imagine anytime you've been in the car or on a train, you are moving forward in space in a linear motion. And so a lot of people tend to fall asleep when they're in the car. And babies certainly fall asleep a lot when they're in the swing. So those are some examples kind of showing how calming that kind of input can be. The girl on the top right is sitting on a wiggle cushion, and so that is giving her some extra vestibular input. Basically, every time she kind of moves, the vestibular system's getting activated, so that can help her kind of stay alert. The kiddo on the bottom left corner is participating in the burrito activity, which is a vestibular activity. It's also a proprioceptive activity, but what that is basically the kids, you roll out like a towel or a blanket, and the child kind of gets inside and tucks their arms in, and then you help roll them up in that blanket nice and tight, and then they kind of unroll out of it. So that rolling, that log roll, is the vestibular portion, but it's also proprioceptive because they're laying on the floor and they're getting all that extra input to their body, like with the gravity. Then the girls on the bottom right are playing the row, row, row your boat activity, and they're going back and forth in space. So they're activating their vestibular system in a linear direction. Okay, and then for more vestibular activities, so on the left, on the top is an egg chair, so spinning. Something to note about spinning is it's just a very, very, very powerful type of vestibular input, and you have to be careful. Kids, when you spin a child, they can have effects all day from that vestibular input, and it may not be very calming for them. You can also have like physiological changes and blood pressure and things like that. So before you spin a kiddo, you might want to talk to your OT about that. And there certainly are precautions with regard to kids with seizure disorders that need to be discussed. So whenever I decide to spin kids, for example, it's always in a very controlled manner, 5 spins to the right, 5 spins to the left, then all done. Maybe with a couple repetitions of that, but whenever you finish with something that's like spinning, that's a very strong vestibular, you always want to follow that up with a proprioceptive activity. So a big hug or some jumps on the trampoline or some jumps in place, just to kind of get the kids grounded again, because sometimes that spinning type of vestibular can really kind of send kids out into outer space a little bit, and you got to bring them back down to earth. Slides are a great vestibular activity. Bubble steps or balance beams. And at home, you can use things like pillows, right? Like if you don't have some of these materials, any unstable surface that a kiddo is walking on or sitting on is going to activate that vestibular activity. Kids on the bottom left are rolling down a hill, great vestibular. And then on the bottom right, that's a little preschool classroom, and they're playing Ring Around the Rosie. Okay. So generally, we know that our senses can either calm us or activate us. So we're kind of done talking about the big 3 senses, and we're talking about all the senses. So some general rules of thumb of what's calming versus what's alerting. And it's good to know every child is different, but these tend to be patterns of things that are calming versus alerting. So neutral warmth is more calm than like a cold temperature. Softer textures are more calming than maybe scratchy, bumpy textures. Slow linear movement, things like swinging, rocking, are more calming than maybe like bouncing and spinning. And that's not to say bouncing and spinning are bad. It's just that you might want to use bouncing and spinning with a kid who's kind of under alert, under aroused, compared to maybe a kid who is kind of overreactive and over alert and over aroused. You might want to bring them down using the more calming linear movement. Dim lighting, more calming; bright lighting, more alerting. Even the olfactory system, so scents like lavender, vanilla can kind of be more calming. Scents of orange, peppermint, more alerting. Deep pressure massage, calming. Tickles, alerting. And again, there are some kids where tickles are good. Some kids do need to wake up a little bit, right? But then there are other kids who just, if you tickle them, that will just send them over the edge and just would not feel good to them. Weighted blankets, calming. Running, jumping, skipping, hopping, alerting. Slow rhythmic music is more calming than fast music, especially if that fast music doesn't have much of a rhythm to it. And then also just something to keep in mind is that the adult's kind of affect can jive with the kid's sensory system and kind of help them with calming. And then an adult who is kind of more that high energy, like dog and pony show, look how exciting everything is, that can also be alerting for a child too. So really, when you're working with a child, using your therapeutic use of self to help a child's sensory system. Okay, so we've reviewed the 8 senses, and let's just talk real quick a little bit more about processing. So we talked about how this happens in the brain, and sensory information is detected, perceived, modulated, and then you have that adaptive response. So just a couple examples of this. So in this case, the little baby's reaching out toward the candle. So we have our tactile receptors, so that's the stimulus. So it's going to the brain, and that sensory information goes to a very specific part of the brain. And so it's detected, basically this is heat, it's perceived, okay, I'm feeling it on my fingers, and ooh, it's very hot. And then it's modulated, where you know that this is a very, very hot flame, and it's not just something that's warm. And then your brain is also getting information from all the other senses. Oh, okay, well, it's also bright. What color is it? What does it look like? What does it smell like? because this baby is learning. And then the adaptive response in this baby's case is, ooh, withdraw. Another example, so we're picking up a pitcher of liquid. So we're using our visual system, we see how much liquid's in there, we see where the shape of the pitcher. We're using our tactile system to know how to grip the pitcher. And we're using our proprioceptive system as we pick it up to understand, oh, this is heavy, I have to use more force on my muscle. Maybe I wasn't sure if that was glass or plastic. So your proprioceptive system helps you understand, oh, this is heavy, this must be glass. Then that stimulus goes to your brain for processing, and then the response is coordinated movement. Last example here. So you get dressed in the morning and there's a little tag on your shirt that your parent forgot to cut out. And that tactile information goes to your brain for processing. And if it's modulated and processed correctly, your brain's going to just habituate to it. So it's going to basically forget that that tag is there in your clothes. So if it's modulated properly, you're going to be the kiddo on the left raising your hand in class and just forget about it and go on with your day. But if it's not modulated properly, if you are, then you might over-respond to that little tag in your shirt and, you know, have a meltdown by lunchtime. Okay, so when you are not processing sensory information well, so you have the meltdown by lunchtime, or in this case with the pitcher, you can't lift and pour the pitcher with coordinated movement. So if your proprioceptive system isn't working, you might pick it up too fast, you might fling it across the room, you might not know how far to turn your wrist in order to pour, and so you're gonna have water spilled everywhere. So something to know is sensory processing. There's quite a range of what we would consider like normal. Some kids are just a little bit more sensitive, but it's not this big problem. Some kids are a little undersensitive. There is a range, and even like looking at the adult world, there are very different people in terms of, you know, some people love big loud parties and other people are kind of more introverts and they like to kind of cuddle up with a blanket and read a book. But we really have concerns when sensory processing impedes function. So, you know, is this child not able to learn? Are they not able to participate in their classroom? Something to know about kids with sensory processing challenges, and especially kids with SPD, like they are consistently inconsistent. So their performance can change really from day to day. And something else to take note of is all of those 8 systems, you can be oversensitive in one system and undersensitive in another. So sensory processing disorder, it used to be called sensory integration disorder, but it's a condition in which sensory input, either from the environment or from one's own body, is poorly detected, modulated, or interpreted, and you get atypical responses because of that. It is not officially recognized in the DSM-5, and like I said before, laboratory studies suggest that sympathetic and parasympathetic nervous systems are not functioning typically in children with SPD, and it's really hard for some people to understand sensory processing disorder because it's hard to really show the physiological markers, but there have been studies, and we'll talk about a few of them, about which studies have been done to show that there are some physiological markers that are showing it. But generally, it is harder. It is kind of something that we more look at a child's or a person's behavior and kind of get information about how they're processing sensory information based on their behavior and their responses to sensory input. Risk factors for sensory processing disorder. We do not know what is causing this. Heredity may be one cause of the disorder, prenatal birth complications, environmental factors possibly. We do know that just based on correlation, low birth rate, prematurity, prenatal complications, maternal stress and illness, maternal use of medications, delivery complications, assisted delivery methods, for some reason, being an ethnic minority and lower socioeconomic status are just correlated with SPD. So not necessarily causing it, but they're risk factors. And then prevalence, there's a huge range in terms of how many kids there are, people there are with SPD. That range anywhere from 3% to 28.6%. And it just depends on where the study's being done. And so it's not a great estimate in terms of how many people have it. It does seem to be higher with kids who are gifted, kids with ADHD, autism, Fragile X syndrome, compared to the general population. And it is important to note for, so as we know, ADHD and autism, there's a lot of comorbidity with sensory processing disorder, but sensory processing disorder does not necessarily encapsulate. So there are a lot of children who have sensory processing disorder and don't have any of those other comorbidities. So that's important to know. And then also the SPD Foundation suggests that more than 3/4 of children with autism spectrum disorder have significant symptoms of sensory processing disorder. And we will talk a little bit about kids with ASD and what kind of patterns they display on average. And then there have been studies that show a significant difference in the actual physiology of the children with SPD and ADHD. So some people had thought up to this point that maybe they were the same thing, but they're actually not the same thing. They're separate. They're separate. They're morbidities, I guess you could say. But they are often comorbid. Okay, so physiological differences. So basically, one study that was done with the electrodermal activity. So it's basically measuring, they put a low voltage onto the skin and measured how much that, that person's body responded to the sensory stimuli. And so children who had been diagnosed with sensory processing disorder and the sensory over-responding subtype, and we're going to talk about the subtypes later, but they were reported to have an increased number and larger electrodermal responses to sensory stimuli, as well as slower rates of habituation. So habituation means you're getting used to that stimulus compared to typically developing children. So their bodies were getting the stimulus and saying, whoa, that's a big stimulus, and not getting used to it compared to the typically developing children who did not have the SPD diagnosis. Another study was done with electroencephalography, EEG, and they basically played cartoons, and some of them had sound, some of them didn't. And they did a lot of things with the cartoons and had them answer questions and things. But basically, kids with the SPD group had less sensory gating, so their ability to kind of filter out auditory information that wasn't part of their, basically extraneous auditory information. And they had more variability compared to typically developing children. And they were also found to have decreased ability to regulate sensitivity to changes in frequency and loudness of auditory tones. So they weren't quite noticing maybe the changes in the loudness and the auditory tones. And then another physiological difference, there's a study done showing boys with SPD have decreased white matter connectivity, particularly in the parietal regions of the brain. So the white matter is basically just, on the picture down here at the bottom, that's a nerve cell, and you have the cell body, which is the gray matter, and then the myelin sheath on the axon of the cell body is the white matter, and that myelin is basically fat, and the fat helps the electric conductivity of the impulse, and so that is the white matter. And so remember, we're talking about all those different all those sensory inputs going to the brain to be processed, they're all processed in different parts of the brain, but they have to integrate. So that white matter, that's basically like the highways for those pathways to get together. And so it makes sense that there would be decreased white matter if they're having challenges integrating their sensory inputs. So how does sensory processing disorder get diagnosed? So typically when there are sensory concerns from a family, that the starting place would be a child's pediatrician. The pediatrician may want to do a screening, extra parent interview. They may also want to rule out other diagnoses. And from there, a referral might be made for an evaluation with an occupational therapist who has advanced training in sensory integration. So the OT, so it is a specialized thing to diagnose sensory processing disorder. It's not something that every OT does. And there are some of the standardized measures that an OT might use for sensory processing disorder are things that you have to have special certification in. So for example, the SIPT, the SIPT test, you have to do a special course and get certified to give that test. So, but the process of evaluation would include detailed clinical observations, parent report measures, and standardized measures. Something to note, school-based OTs do not diagnose SPD. This is done kind of more clinical setting. And OTs do not need a physician's prescription to evaluate and treat patients in the state of Oregon, but it could impact reimbursement. So that's typically how that process kind of happens. But you know, sometimes if there are sensory concerns, at least from the school's perspective, we don't need a diagnosis of SPD in order to support kids with sensory processing challenges. We recognize that, you know, a child is the child in front of us, and we look at their sensory performance just like we look at any other performance of theirs, and it is something that we can support regardless of whether or not they have a diagnosis of SPD. Okay, so the occupational therapist's role in the treatment of SPD, it's very different based on the clinical model versus the educational model. So in the clinical model, the focus is on parent education and of course, remediating a child's sensory system. They might formally diagnose SPD. Their model tends to be a direct model, so they might be doing some direct therapy. It's usually quite intensive. They might work with a child directly like 5 times a week with parent training sessions, maybe a couple times a week. But oftentimes this intensive therapy is short-term. The funding for this clinical OT, it's either insurance or out of pocket. And oftentimes it's done in a setting that looks sort of like a sensory gym. They might have ramps, trampolines, zip lines, swings, ropes to climb, hanging bolsters, all kinds of really fun and cool stuff. And they may also have intense feeding clinics for sensory-based feeding disorders as well. So the goal of therapy in the clinical model tends to be to facilitate arousal, alertness, regulation, improve relationships, and also to improve sensory integration. So there is that goal of trying to improve that performance, that kind of like that remediation goal. In an educational model, it's very different. The OT is really working on training and educating staff so that the staff can understand how to teach the child, and also, of course, parents. That's always part of it too. OTs in an educational setting will not formally diagnose SPD, but we can definitely help a child, help identify child's patterns of sensory processing so that we can help the team understand how is this child learning, what kind of things can we do to support this child in the school environment. The model tends to be consultative, funded by the school district. And then in terms of intervention, sensory diets used to be really popular, where an OT would look at a child and say, okay, at 9 o'clock, you're gonna put them on the trampoline. At 10 o'clock, you're gonna give them a massage. At 11 o'clock, you know, but people are sort of moving away from that because, first of all, kids with SPD are consistently inconsistent. They may not need the same things every day. And also it's a lot more helpful to the adults working with the child to really understand what are the child's sensory needs and kind of be able to know how to embed those needs into their everyday routine. And also to be able to understand signs of dysregulation and understand when to best use sensory input and other regulating strategies on a daily basis. And so the goal really for in the school is to help a child access their educational program through accommodations, environmental modifications, equipment, and staff and family education. So the school's role in a nutshell, we want to optimize the environment and individualize instruction to accommodate a child's sensory needs. We're not here to try to fix a child's sensory processing, but we want to support their ability to function in their environment. So we're looking at things like regulation, attention, engagement, so that the child can build all those skills that we want them to develop: communication, adaptive skills, social emotional skills, pre-academics. And then of course, we're looking to improve motor function as it relates to functional school activities. So putting toys together, all the little things that they have to do, snipping with scissors, holding markers and crayons, all those great things. So sensory processing disorder has quite a few subtypes, and we're really going to focus on the sensory modulation disorder subtype today because that does have a lot to do with a child's emotional responses and their attention, alertness, engagement, and just overall emotions. So, but we'll talk quickly about the other types as well. So sensory modulation disorder, basically it's that ability to look at that sensory input and respond appropriately. So not to over-respond, not to under-respond. So you have the sensory over-responders who that input just, it seems, they respond in a way where the sensory input feels to them a lot more intense than it would feel to a typical child. Then we have the sensory under-responders. So they are not really responding very much to sensory input. So these are the kids who maybe fall really hard on the playground and just get up and walk away like it was nothing. And then you have the sensory cravers, where it's just, they just want more and more sensory input, as if they maybe hadn't even gotten any. Sensory-based motor disorder, that's basically when that sensory processing interrupts significantly a child's ability to move their bodies. So we have somatodyspraxia, so that's difficulty planning and perceiving your body sensations in order to plan unfamiliar actions. Kids with dyspraxia would, for example, maybe not have as hard of a time running, because that's not an unfamiliar action, just running, but they might have a really hard time learning a new yoga pose, or learning how to, or like knowing how to like play soccer, or something that's very dynamic, shifting their body, learning how to skip. We have the vestibular bilateral integration deficit. So that's basically kids who really have a hard time with their postural control, their ability to use two halves of their body together. And there's a lot of overlap between all these things. And then you have the visual dyspraxia. So kids who have difficult time perceiving visual spatial information and just using their visual system to get information about the world. And that one's a little bit hard at a very young age to see. So some of these things are easier to tease out as kids get older into school age. So that's important to know too. And then you have sensory discrimination disorder, which are just very kind of specific challenges with specific types of sensory input. Okay. So one thing I just want to talk really quick about autism spectrum disorder is there are some patterns that are kind of coming out in terms of how kids with autism specifically are responding to sensory information. So these are kids with autism that are having some sensory processing challenges. And remember, we talked about that estimate is up to about 3/4 of the ASD population are having significant sensory challenges. So some of the, there are 4 clusters that, it was an occupational therapist who did this study. So you have cluster 1, so these are kids who had just real mild sensory impairments. You have cluster 2, so these are the kids who primarily taste and smell sensitive, but they also had, so they're kind of over-responsive in that taste and smell area, and but they're also moderately under-responsive, in other areas too. And these are kids who tend to be very stress reactive. So think about your kids who are very, very, very picky eaters, very, very, like the first kid to smell something gross in the room. They're very over-responsive. Cluster 3, you have the postural inattentive kids. So those are the kids who might fall out of their chairs, or they just have no idea where their body is in space. These are the kids who they have a hard time processing multiple sensory input all at once. And they basically, these are the kind of the kids who are like the wet noodles in the group. And then you have cluster 4 who have generalized sensory disturbances, lots of stress reactivity, and just multiple areas. So interesting to note that all the clusters, at least in this study, was found that there was impaired auditory filtering. So that's kind of one of the commonalities that was seen in ASD. And then also another commonality was that hypo-responsive, so that sensory under-responsive pattern. And interestingly, that led to seeking behavior. So kids who are maybe under-responsive to their body sensations might seek out extra input so that they can feel their bodies better. Okay, so we're going to go into some actual examples with sensory modulation disorder. Okay, so we are going to first look at some examples and talk a little bit more in depth of sensory over-responders. Okay, so over-responsiveness. So these are the kids who they avoid sensory experiences, or they have an exaggerated reaction. They get very upset maybe with accidental touch. They're fussy, stressed. They may refuse to touch glue, glitter, sand, Play-Doh, chalk, water. Maybe they were hard to calm as a baby. Maybe poor sleep. Maybe they were poor sleepers as a baby. They possibly skipped the crawling phase as a baby, because if you're over-responsive and you are learning to crawl, you may not like the sensation of carpet or grass on your hands, and you might just say, you know what, I'm gonna wait and I'm gonna pull up on the furniture and just walk. Remember that homunculus with the huge hands? So things like grass and carpet on your hands to a baby with tactile defensiveness, they might actually skip the crawling phase because they don't want to touch. They might ask the parents to cut out tags in their clothes. They are often picky eaters, and they might go into fight or flight response with loud noises or unexpected touch. Some real life examples of over-responders. So you have a little girl on the right on the top who's just not having it. Her arm is pulled away, and she's scared of that finger paint. She does not want to touch it. You have the kiddo on the top left who's just he's shutting down. He's trying to get away from it all. Everything's too much. And then the 2 boys on the bottom just over-responding to whatever's happening in their environment. The kid on the roller coaster, I can really relate to him. So he's over-responding to that vestibular input of feeling the roller coaster drop down compared to the kid behind him. So potential problems for over-responders, they have a lot of meltdowns and tantrums. They're in fight or flight a lot, very stressed. They may want to leave the classroom or try to leave the classroom. Or like, in the home environment, maybe they might try to flee, like if you take them to the grocery store. They would overreact. These kids might overreact to accidental touch and become aggressive, push kids away or hit them. Sometimes they can have ritualistic or rigid behaviors because they're trying to kind of orchestrate their day around their sensory systems and make sure that everything's going to be okay. They might be the kids who refuse to participate in painting or gluing activities or messy play. They might be afraid of the bathroom because bathrooms are very loud, echoey places with loud toilet flushes. And they might just feel unsafe in unpredictable or chaotic environments. So things like places like the grocery store, parties, family gatherings, assemblies, like later in elementary school. And so sometimes over-responders can have a hard time with their relationships because, you know, as a baby, for example, if you have a tactile defensive baby, one of the ways that you that parents bond with babies is to touch them, and sometimes that it can be a challenging thing for these babies who are over-responders. So strategies to deal with over-responders. So the overarching goal is you want to help them prevent sensory overload, and you want to help them feel safe. These kids are in their fight or flight response a lot more than they should be. And so you really want to prioritize them feeling safe. So as a result, you always want to honor their need to limit aversive sensory input. So if you have a kiddo who is not wanting to touch that finger paint, you say, that's okay, you don't have to touch it. You can use a paintbrush, or you can poke it with a stick. You don't have to touch it with your hands, it's fine. You also would, it helps to warn sensory over-responders of any change in routine, because remember, they might be orchestrating their whole day so that they can predict what's going to happen next, which can really help them deal with the fact that like the world is scary and aversive to them. So whenever possible, warning the child of any changes. These are kids where visual schedules really go a long way, or any kind of schedule goes a really long way. But especially if there's something like a fire drill, or there's like a noisy, smelly, sticky activity coming up, just kind of helping them understand that it's coming up and that it's going to be okay. And for over-responders, it's always good to let them know where their break area is and where they can go to get a break. Really, really, really important to have a break spot for them, and for them to take as many breaks and as long of a break as they need. And then kids, especially preschool age kids, they will come back when they're ready, and they won't stay in the break area forever. They will come back, especially as they get more comfortable. Other kind of smaller strategies, sometimes kids who are don't like to be touched, you know, that unexpected touch is too much for them. So if they're last in line, they can see all the kids in front of them, no one's going to touch them from behind. That could be a strategy to use. Understand that firm pressure is usually preferred over light touch. So you don't really want to tap a kid really lightly on the shoulder from behind if they're an over-responder, because that might feel really, really unpleasant for them. You would want to come from the front and probably not touch them at all. But if you need to touch them, firm pressure. And you want to slowly, if you can, build up their tolerance to sensory input, then you should try it. So examples would be in the classroom, having a sensory bin, and, you know, encouraging them by putting maybe some of their favorite toys in the sensory bin, but never grabbing their hand and putting their hand in the sensory bin. You follow the child's lead, and you'll get further that way. Okay, let's talk about sensory under-responders. So these are the kids. So you can see this kid in the picture is wearing his shoes on the wrong feet and just has no idea, and his clothes are kind of turned around on his body. He's just kind of one of those kids, easygoing, might be hard to get their attention, may not realize when they're hungry, thirsty, hot, or cold, may not notice if their shirt's on backwards or their shoes are on the wrong feet, may not notice food on their face. These are the kids who tend to have a high pain threshold. They might be fearless. They might need sensory input to feel more sensory input, more intense input to feel things. And they may seem a little like spacey or in their own world. So some real life examples of under-responders. So you have the person who put on 2 different shoes and didn't notice till she got to work. You have the kiddo who has no idea that there's this motion behind him of this lion trying to eat him. And then you have the kiddo who's on the on Splash Mountain, who just doesn't really feel much of anything. He's not terrified at all. He just, it's as if he's just sitting in the classroom, not moving. Potential problems for under-responders. So the child's not picking up cues from the environment as they would be expected to. So they might not be very alert. They may miss directions. They may miss cues from the environment. Another thing is sometimes these kids might be considered easy kids because they're pretty easygoing and get like overlooked. But it is a problem if they're not understanding the cues in the classroom, then they're not going to be participating fully. So it's good to really make sure that you're seeing these kids and understanding that they might need an extra cueing or extra help to know what's going on. These kids might also have poor social engagement because they're just kind of overall like under aroused, under alert. They may have poor coordination. And another thing these kids might do is they may try to compensate for their poor sensory registration by doing things that give them more input. So they might be, you know, bouncing in their chair or rocking their body or chewing things. And it might look like, to a teacher who doesn't really understand, it might look like they're acting out, but they're just really trying to get more sensory input. They're trying to stay awake and they're trying to feel their bodies. So some strategies, movement breaks, really good for these kids, jumping, sitting on a wiggle seat, so activating that vestibular system, tickles. You may need to get their attention in more dramatic ways. So instead of saying, all right, class, it's time for motor time, you may need to flip the light switch off and on to get their attention and then say motor time, or you may even have to get really close to their face, in their face, and say, Johnny, next is motor time. Another thing you can do is using heavy or textured materials. So there was the example of the little girl stringing the beads and pulling them along the knots. So that's something that gives you a little extra texture and a little extra sensory input. These are kids who tend to do better with chalk, oil pastels, sandpaper, because that's extra feedback for their bodies. These are kids who might need a chewy, because that is helping them get more sensory input to their jaw. They may need help with, if they're learning a new motor activity, to help them maybe motor their body through it, to kind of get their joints ready to feel that. And also sometimes using a slant board or an easel can help, because these are the kids who are kind of like under alert. Having their work on a slanted surface in front of, like right in front of their face, right in their line of vision, can really help them attend to it better. Okay, and then last we have the sensory cravers. So these are kids who love sensory input. They crave like the more bright, loud, intense, fast. They love it, the better. They're in constant motion. They may be skipping, hopping instead of walking. They could spin, spin, spin and never get dizzy. They would touch everything in sight. They love big hugs, rough play. They enjoy loud music, spicy, flavorful food. So these kids are a lot of fun. Sometimes they get into a little bit of trouble in the classroom if you know, teachers aren't quite sure what's going on. Some real life examples of sensory cravers. You know, these are like, as adults, these are your skydivers, these are your race car drivers, you know, your party animals. This girl is having her spicy, hot, crunchy Cheetos on her sandwich. So like, just the more sensory input, the better. Potential problems, a lot of these kids can't sit still. They might constantly touch their peers, can't maintain personal space, chewing items, grinding teeth, constantly humming or making noise. So there might be some social consequences to that. And sometimes these kids get in trouble because they're constantly moving. Strategies for sensory cravers. So your overarching goal is you want to provide them with extra sensory input so that they can get into that just right state of learning. So you have them holding a small fidget can help them, because if you give them something for their hands, it would reduce the amount of whole body fidgeting that they'll have to do. So sometimes, like during circle time, holding a small fidget, having the child sit on a carpet square or a wiggle cushion, that helps define their space. And it also can give them, like a wiggle cushion would give them a little extra opportunity for movement. You can have them, the child can be the line leader so that they're not tempted to touch the peer in front of them. Movement breaks, of course, really good. Something to know about movement breaks is sometimes people think of movement breaks as just, I'm going to let the kids run outside and have some time, like fresh air, and run around and come back in and they're going to be regulated. Well, unfortunately, it doesn't really work that way. So sometimes just running around and having like this unstructured active time isn't very regulating. So the things that are regulating are things like movement activities that are organized, that require both halves of the body, things that have like a rhythm to them. So like, for example, an obstacle course where a child crawls, hops, walks sideways, and then is all done, and they do it 3 or 4 times, is going to be more regulating than just running in a circle outside. And of course, you know, heavy work movement breaks, very, very regulating. Yoga is great. Weighted backpacks, any heavy work jobs, good movement breaks. We talked about sitting on a wiggle cushion or an exercise ball or a half inflated beach ball, putting a TheraBand on the chair legs and having kids be able to kind of stretch them with their legs. Weighted blankets, lap pads, hats, pressure vests, they're getting that extra input. Sometimes kids benefit from chewing gum. Even kids as young as preschool age can benefit from that, as long as they can kind of be taught how to use those rules, you know, chewing in terms of, you know, where do you put your gum when you're all done and things like that. Oral chews, water bottles, and inverted positions where your head is kind of down below your body, like downward dog, is those tend to be quite calming to the nervous system for sensory cravers. And then again, lying on their tummy is a lot of extra sensory input, which we talked about. And it's also nice because laying on your tummy helps you focus, because you're going to be a lot less tempted to get up and run across a room and choose something different when you're laying on your tummy and your little project is right in front of your line of vision. Okay, so we talked about a little bit about sensory-based motor disorder, but it's not the focus of today. And we did talk about sensory discrimination disorder. So we're getting toward the end here of the training, but I did want to talk about when and how we should use sensory strategies for self-regulation. So this little chart is basically represents a kiddo who starts calm and then gets triggered by something and then basically has a big tantrum or a meltdown and then recovers. So that's kind of what that curve represents. The time to teach self-regulation and the time to use sensory strategies really is when the child is calm. That is the time when they can learn and when they can, you know, you're being proactive with the sensory strategies. And also if you're doing something like, for example, teaching them what the emotions are, or if you're teaching them an actual program like the zones of regulation, or you're using a little thermometer, you know, happy, silly, upset, things like that. Teach those when they're calm. Once they get to that agitation phase, that, you know, acceleration phase, maybe you could use some visuals that you had taught the kiddo when they're calm earlier, to kind of, oh, it looks like you're starting to get a little bit angry. Like, you can, but once they get to that peak, they're not in a position where they're going to learn anything. It's not the teachable moment time. It really is just a time where you as an adult, you can't do too much, but you can be there with them, empathize with them, reassure them it's going to be okay, that you're going to help them, and just remind them that you're there to help them stay safe. Okay, and then I had told you that this training was originally meant for speech therapists, so I did a little case study here. So basically, it's about Zach. He's a highly verbal 4-year-old, and you're his speech therapist. He's in a community preschool, and he qualifies for special ed in the category of communication disorder. But he additionally shows patterns of sensory cravings. So he's chewing his shirt, constantly jumping around the room, spinning. His teacher says it's really impacting his ability to function. So as a speech therapist, you would gather information and prioritize with the team to come up with a plan. So you would talk with the teachers and parents about how Zach is functioning at school and home. Where does he have the most challenges? What have they tried? what has and has not been helpful. And depending on the level of impact, you may want to consult with your OT and have parents and teacher fill out a screening, such as the sensory processing measure or the sensory profile, and an OT could help you with that. You'd want to observe the student and start to prioritize with your team. What are the biggest challenges for Zach? So then you're going to brainstorm some tools for self-regulation. So in Zach's case, he does really well at circle when he's allowed to hold a little something in his hand, or when he wears a chewable necklace. He tends to be calmed by heavy work, and then he also has a little favorite stuffed animal. So then you would prepare with your team some visuals. So you could potentially use some actual self-regulation programs, such as zone of regulation, or you can custom make some visuals. And so these visuals will be something along the line of, Zach, how are you feeling? So kids can understand their emotional state or their level of kind of regulation, like my engine's running good, my engine's running a little high today, oh, my engine's running low, I'm tired. And then you want to gather your sensory material. So in Zach's case, it would be the Chewy. He liked the weighted backpack, extra heavy work. He has a stuffed animal, and then he has his little box of fidget items. And then you would want to implement the plan. So introducing the visuals, such as the visual thermometer, and so that he can understand his level of regulation, and use age-appropriate language to explain that his body feels more calm and his ears listen better when he's able to get his wiggles out. It's really important for kids to understand the way their body is working, and the way that they have the power to regulate themselves and make themselves feel better by using tools. Keep in mind, Zach is a very highly verbal kiddo. Not all the kids we work with are highly verbal. Sometimes they have a lot more, their disability impacts them a lot more. And so, it's something to think about. In Zach's case, we're really teaching him that self-regulation, him using those tools, but sometimes it's going to be more a matter of working with the adults in a child's classroom where, it's kind of that more co-regulation and helping, obviously you want to build to self-regulation, but kind of helping the staff understand where the breakdown is and how the child's sensory system is maybe keeping them from attending or keeping them from fully participating, and what are some things you can do throughout the day for them. So basically with Zach, you've taught him how to use his little thermometer with age-appropriate language. You've shown him what his heavy work jobs are going to be. And so, for example, in his little classroom, his heavy work jobs are to scrub the tables with a washcloth. So that's heavy work. Putting books on the shelves, is his other heavy work job. And then letting Zach know he can ask to take a break with the teacher's aid when he's feeling wiggly, and they can put his little stuffed animal in his weighted backpack and take him for a walk in the hallway. I know this is not always possible. This is just a case study of, this particular just if this were to be in a classroom that had those, like that extra adult in the room and whatnot. And also letting Zach know that he can take a break with his favorite stuffed animal in a quiet corner if he's feeling sad or overwhelmed. So then you want to monitor the plan, communicate with the teacher and the parents regarding effectiveness. And again, if Zach's needs are pretty high in this area, like if you as an SLP need that extra support from the OT, that's something to consider in terms of adding those services if needed. Sometimes that's not necessary, sometimes it is, but you'd want to monitor the plan, communicate with the teacher and parents, and observe those behavioral changes that are coming from those new tools. Be flexible and change the plan as needed. Okay, if you have any questions, you can email me, or you also, every site has several OTs at it, and they will be happy to answer any of your questions about sensory integration and sensory processing challenges and SPD. Photo credits here and sources, and thank you so much. Okay, thank you so much for joining me, and have a wonderful day.